Alrighty. Hi, everyone. Welcome to our Hot Topic Tuesday. You are joining in with April and Trish. And today's topic is PCOS. We actually did a social media post today about PCOS, and this is a topic that we actually have not covered on our Hot Topic Live before.
Mhm.
But we get it all the time and we hear it all the time. A lot of struggles with PCOS and the inability to lose weight and just a lot of gnarly symptoms and so forth. So we are here to kind of deep dive into all things about PCOS. Now, first of all, let's start with what exactly is PCOS? And PCOS, also called Polycystic Ovarian Syndrome, it is a common hormone disorder affecting women of reproductive age. Some of the characteristics are irregular periods, excess androgen hormones, and oftentimes small cysts on the ovaries. Um, it affects up to 10% of women worldwide and is one of the leading causes of infertility. And with that being said, I'm going to move into some of the common symptoms that a lot of you are probably struggling with on a regular basis. Some of the common symptoms would be, first and foremost, would be irregular periods. Fewer than 9 periods of a year or cycles that last longer than 35 days. That's one of the keystone symptoms of it. Excess androgen hormones is the second symptom. So signs of high male hormones, such as having acne, excessive hair growth, thinning hair, or male pattern baldness. So tend to get like facial hair, the dark hair on the arms. That is one of the another keystone symptom of PCOS. Um, Weight gain. This is the one that Trish and I hear very, very often. So difficulty losing weight and unintentional weight gain is often associated with insulin resistance, which is tied into PCOS. And the obvious ovarian cyst. So ovarian cysts, like small fluid-filled sacs on the ovaries, though not all women with PCOS will have them. And then the last thing would be skin issues. So having darkening skin and then finding like little skin tags here and there. It's funny because I've noticed, Trisha and I, we talk about, because we both, when we were younger, we were both sun lovers. I don't want to say sun worshiper, but of course,
Pretty
I'm
close.
I'm
Mhm.
starting to see some of the effects,
Oh, yeah.
Yes, and I'm like, oh, I was just having a conversation with someone in the gym today, and I'm like, I grew up in the era. I remember my one of my sisters would like put like baby oil and
Oh,
mayonnaise
yeah.
to get
Mhm.
the darkest tan, and now I'm like, oh, go to
Don't do it.
yeah,
Yeah.
go do it.
Now I'm, like, begging him. I'm like, "Put your sunscreen on."
Exactly.
Mhm.
Okay, so the some of the causes of PCOS. The number one would be insulin resistance. Many women with PCOS have insulin resistance. Like that's almost a common theme, which can in turn increase androgen levels and cause symptoms. The second would be hormone imbalance. So hormonal imbalance, increased levels of the luteinizing hormone or androgens can interfere with the menstrual cycle and ovulation. So, just overall hormone imbalance in general is going to obviously affect the menstrual cycle and in turn kind of throw things out of whack. And then lastly, it would be genetics. Genetics, PCOS tends to run in families and be hereditary, suggesting a genetic component. So it is very common that, like, if your mother had PCOS, it's not uncommon for you to have PCOS as well. Now, some of the health risks that are associated with PCOS. The number one is probably infertility. PCOS is the leading cause of infertility just due to irregular ovulation or lack of ovulation in some cases. The second thing would be metabolic issues, increased risk of type 2 diabetes, insulin resistance, and metabolic syndrome. Insulin resistance is super, super common. So in turn, with that comes can cascade into a lot of other health issues like diabetes, the metabolic syndrome, so forth. Heart disease, that's another one. It has been linked to an increased risk of cardiovascular issues due to obesity, high cholesterol, and again, insulin resistance. Um, Another one would be endometrial cancer. So lack of regular ovulation can increase the risk of endometrial hyperplasia or cancer. So the lack of ovulating in turn can cause bigger issues down the road. I hear women all the time that they're always complaining about their cycle. And I tell them, like, if you can get your cycle, if we can get our cycle, we should be getting our cycle. It is a healthy thing to get as a woman. If we are in the fertile years, then we should be getting a regular cycle, a regular menstrual cycle, because it is healthy, for our body to do so. Another thing would be mood disorders. It is oftentimes linked to increased rates of depression, anxiety, and mood swings. Now, that being said, how do you diagnose PCOS? There's a couple of criteria that you have to meet to diagnose PCOS. Women usually need to meet at least two of the three criteria. First one would be irregular periods, so it's an obvious one. So irregular periods, signs of the second one would be signs of high androgen levels. Now, clinical or via blood tests. So say you got irregular periods, say you've got signs of higher androgen hormones. So you might be like losing scalp hair, you're growing facial hair, so forth. That's another indicator. And then the obvious polycystic ovaries visible via ultrasound. There are additional testing that can be done, like blood tests to check your hormone levels, which if anybody's interested, Trish and I could, do that for you. Insulin resistance and cholesterol testing. Plus, you could do a pelvic ultrasound to actually examine the ovaries and see if there are any cysts present. And with that being said, Trish is going to take over the lifestyle and dietary strategies for managing PCOS.
Yes, because since I think I mentioned this in the social media, it's kind of this term. And while there are the criteria that April mentioned, it's still just something that I think sometimes doctors are like, we don't really know PCOS, type thing. So lots of different subcategories, I guess, to it, and different symptoms that a lot of people can experience. But lifestyle and dietary strategies are key in managing PCOS, and there's a lot you can do with those also. So first is weight management. So even a 5 to 10% weight loss can improve symptoms and regulate your menstrual cycles. And you'll see that thrown around a lot. Like a lot of disease states, honestly, just take that 5 to 10% in weight loss, weight management. So for diet, focus on low glycemic, and that's because there is a heavy component to insulin resistance with PCOS. So focusing on those low glycemic carbs are great. Anti-inflammatory diet. We want whole foods, lean proteins, fiber, lots of fiber, good healthy fats, and plenty of vegetables. And that diet right there, I feel like is great for women of all ages and any phase of life you're going through. If you could just imprint that and do that, you'd probably be feeling amazing. Reducing processed foods, because those are going to be your refined sugars, those are going to be your simple carbohydrates. We want to focus on like the foods that help manage our blood sugar, so on those insulin friendly foods. And again, those are going to be your whole grains being carbohydrates that have good fiber content to them, and usually they contain a decent amount of protein too. Legumes, nuts, seeds, and of course, our really good healthy fats like your avocados, olive oil, anything but your kind of like seed-based oils there. Exercise is going to be key. We want regular physical activities, strength training. Ladies, again, across your lifespan, this is going to be important. But, because insulin resistance is such a key component of PCOS, anytime we're building muscle, we're making our body like more insulin sensitive, which is such a wonderful thing. And that can also help with some of the just how you're feeling about yourself too, like strength training, building muscle, and having that, is always going to be a little bit more positive for our mood. Um, cardio also will help improve the insulin sensitivity and support hormone balance. Even something as simple as getting out there and getting your walks, getting your steps in will cover that base. Okay, so if, we always want to say, let's try to manage this with diet, let's try to manage lifestyle practices, let's manage all of that, but what can we look to as far as like any supplementation for PCOS? And again, this is going to come way after you're doing the other things because all these supplements in the world aren't going to be beneficial unless you have some of the basics in place. So inositol is a good one, and I actually take inositol because I was diagnosed with PCOS in my 20s, and still it's kind of followed me in certain ways, I guess you could say, throughout my life. And this is known for improving insulin sensitivity and it helps regulate menstrual cycles. It just kind of helps manage blood sugar balance. Omega-3 fatty acids, like this is obviously one you can really look to for foods, with eating some of your fatty fishes. But this will help reduce inflammation and support heart health. And inflammation is a big issue for a lot of the kind of women hormone health states that we talk about. Magnesium's going to help support blood sugar regulation and also limit, mitigate some of that insulin resistance. And then vitamin D, many women with PCOS are deficient, but I would say that many people in the world are deficient in vitamin D, pretty much everybody. So supplementation can help support overall hormone health. And those supplements are not really anything unusual than, we would kind of, have for everybody do. Medical treatments. This is something you definitely would want to talk about with your doctor. I'm just going to kind of out here for educational purposes, but like the food lifestyle, and also protect the uterine lining. But, again, there's a lot of different other ways that you can try to manage it before you may need to do that if that's something you're not looking to do. Metformin.
Your internet froze.
Oh, sorry. Do you
That's
want
okay.
me to go back?
Well, yeah, because the recommendation for in some cases for some people the hormonal birth control that was like
Yeah.
complete. Yeah.
Okay. The hormonal birth control, go back to that. Yeah. It's funny because usually when I freeze, I see myself freeze and that didn't happen, which is weird. So I was saying with hormonal birth control, like again, like please, did it happen again? Oh,
Yeah.
is it good? Okay. Um, so it can help regulate your periods. It can reduce excess androgen symptoms like acne and hair growth. But if you missed this part, like definitely try the lifestyle practices. Definitely try the nutrition stuff. Definitely try all of that
Agree.
before you
There,
go with hormonal birth control. Unless you really want to do for other purposes.
because there are lots of side effects that actually come with birth control. You know,
Yeah.
so if you can do it with lifestyle, diet, exercise, those things, that's what we highly recommend. So
Yeah. Definitely. And I think most people really can if you're really consistent with a lot of the habits. Metformin is another metformin is actually probably one of the most popular pharmaceutical medications like out there for things, but that is often prescribed to help insulin resistance and help regulate blood sugar and improve ovulation. But again, if you go back to the supplementation, inositol or berberine can also be beneficial for that too. So if you do want to go more of a natural route before you're, going and reaching for more prescriptions, those would be great to try. And again, try those only with your lifestyle practices and your nutritional dietary interventions also. Oh,
agree.
it looks like you wanted to say
I was,
something.
yeah, I was just going to add, and this might be controversial, but I saw on social media, this was a while back, and I was like, oh, that's kind of true, is if prescription medications work, then you wouldn't have to take them forever. Like you wouldn't
Yeah.
have to take, if they actually work, then why do you have to take them, for prolonged periods of time, if they
Yeah.
work. So,
Well, even like berberine, that isn't, I wouldn't take that forever. That's something you want to cycle on and off, too. So even again, some of the supplementation that go beyond like your vitamin D, your magnesium, your fish oil, that isn't something you want to take all the time. So that's kind of what we're here for, is to help guide you through the cycles of when to do things and, when not to. If you need fertility treatments, there are, situations again that would just be a conversation with your doctor. I with my PCOS diagnosis, I did have to do a couple rounds of Clomid with my first kid, and I think I did about 3 months with it. I don't recommend it if you don't have to. It caused some like, and there's some interesting side effects to that, but at the same time, like I wanted a baby, right? So I was going to kind of do all the things to manage that. But I didn't know about some of these other things I should have been doing to manage it. Like I was not doing all the dietary lifestyle interventions. It's 20 years, I think we are having some, just weird stuff kind of going on. Anytime there's hormonal imbalances, that can bring up some mood disorders, irritability, stress, body image issues. All of that can definitely happen with any hormone imbalance, but also PCOS. So that's where, again, exercise can really, really help with that. Any stress management. So, self-care practices, exercise, yoga, mindfulness. If you need to talk to somebody about like emotional and mental well-being, that's always great. Community groups like ours are very helpful to, you know, just we really empower each other and boost each other up. And we all these, menopause, perimenopause, all these issues we talk very candidly about. Um, yeah, so we just, empowering women, that can be part of it. So community support, finding support groups or just like-minded groups that, you feel like a safe space to like have these conversations. Education, I think we're quite good at that also. So we can share our knowledge and education, but also everybody has their own stories. And, like I have my story from millions of years ago that I could always share and talk about, even though we have more information these days. And then, your healthcare provider should be like an integral part of helping you manage your symptoms too. But I just like stress again and again, like there's so much you can do nutritionally, there's so much you can do lifestyle, and there's so much you can do with support, whether that's through coaching or whether that's through community. So we are always here for that if you need it.
and we actually have a PCOS guide if anybody's interested. So if you're interested in the free guide, just comment on this video and we can get it sent over to you.
Yes.
That being said, hopefully this was helpful. Aside from Trisha's internet issues, we're only
Sorry. I tried to like watch to see when they were like going off. Usually I'm freezing. I saw you freeze.
maybe it was me. I don't. Maybe it was my internet issues then. I don't know. Hopefully. So anyway, with that being said, hopefully this was helpful, and we will see y'all next week. Bye, everyone.